Hi, everyone, and thank you for joining us today for Beyond Burnout, how Accuro helps clinicians reclaim time and focus. I'm Dee, and I've been with Accuro for almost 5 years now. For the first three-ish years of that, I was part of the Accuro training team, which meant working closely with both our development and product management groups whenever there was a new Accuro release coming. My job was to help our internal users understand what those updates meant and how they would impact our Accuro clinics. I've also hosted a number of client webinars over the years covering topics like the waitlist and our Accuro Engage tools. These days, I work on the marketing team as content manager, and I spend a lot of my time creating demo videos, presentations like this one, and I also run our Tech Tips emails series that some of you might already be subscribed to. In addition to that, I work really closely with our marketplace vendors, helping introduce their tools to both our internal teams as well as clients whenever a new integration becomes available or a change happens. So that's a little bit about what keeps me busy day to day, but I want to take a moment to zoom out and talk about why we do all of this. Everything I just described, from training and communication to client, education, and vendor partnerships, it all ties back to one central goal, that being our mission here at Accuro, to unite Canadian healthcare, connecting providers to information, their patients, and each other. There are almost 500 of us Accuro employees across Canada, all working toward that same goal, helping healthcare providers access information quickly, engage with their patients more easily, and collaborate more seamlessly. That's what drives everything that we do. But our mission isn't just something that we put on a PowerPoint deck at the beginning of our presentations and our meetings. We actually look for ways to measure whether we're living it or not. One of the clearest indicators of whether our technology is helping is how it impacts our providers' day-to-day workload and paying attention to their overall well-being. So that's why we track signs of burnout among our users. It helps us see in real data where we're making the biggest difference and where we can make a bigger difference. Now that you know who we are and what we care about, here is how we track burnout for our users. Our teams look at validated surveys like the Maslach Burnout Inventory, the Oldenburg and Copenhagen scales, so all peer-reviewed, widely respected measures that help us understand things like exhaustion, disengagement, and overall physician well-being. We also keep a close eye on what's happening here in Canada specifically. So things like the CMA survey on physician burnout, CFNU reports for our nurses, StatCan data on stress, and CIHI reports on staffing shortages. All of these give us a pulse on how the healthcare system is doing as a whole. And then within Accuro itself, we look at our own operational indicators, how long documentation time is taking to complete, how much administrative work is piling up, and how often our providers are logging in after hours. Those internal signals help us see where the pressure points truly are. For example, in 2025, we discovered that 15% of Accuro providers log in between 7 p.m. and 4 a.m. That's 1 in 7 providers working at night. And on Sundays, it's 12%. Of course, not all after hours logins mean burnout, but it still raises a concern. What are you doing at that time? Charting, catching up on inbox messages? Is that really how you want to be spending your evenings? And if not, how can we help? Clinician burnout is real, and we know administrative burdens is one of the biggest drivers. It takes time away from the work that matters most, patient care. Accuro can help you reclaim time and focus. We do this by asking, are you making the most of Accuro? Reducing burnout doesn't have to be something brand new. It's about using the resources that you already have, like recent enhancements, utilizing your practice consultant, or taking advantage of add-on tools and services. By the end of this presentation, my goal is to have you leave with at least one new plan to help you reclaim time and focus. I'll also touch on some new and exciting things coming very soon to Accuro towards the end. Let's start with recent enhancements. We've had a number of them this year, but here's a few that I wanted to bring forward today. First, the CPP Flex Panel and Encounter Notes. View patient history and labs right inside your encounter note. And if there's something that you want to include, simply click and drag it directly into your note. No more flipping between screens or copying and pasting. Second, bill from an encounter note. Open the claim details window while you're finishing your note. It's faster and helps you ensure that nothing gets missed. Third, favorite templates and forms. Pin your most used templates and forms so that they're always at the top of your electronic drawer, just one click away. 4, drag and drop in the scheduler. Now your office staff can reschedule appointments with a single drag. No more extra clicks or steps. And finally, customizing quick actions with Control F10. So the Control F10 quick patient view has always been there, but now you can reorganize it. Many doctors choose to bring active medications forward, making inbox reviews faster. Some clients have told us that they use this feature when managing preventative care directly from their home section. For example, if a patient is due for their next mammogram, move that entry to the top of the band so that it's easy to spot and act on. Oh, I forgot the last one. The collapsible sidebar is back. If tiles are taking up too much space, just tuck them in and reclaim your screen real estate. On to our practice consultant. So every Accuro clinic has access to a practice consultant, completely free. They are Accuro experts, many of them former medical office assistants with decades of experience, and others likely starting in client services, answering calls, and supporting clinics, then grew into these more consultative roles. We recommend connecting with your practice consultant at least once a year. They can help update you on new features and integrations, answer any of your questions, and shadow your workflows to suggest time-saving improvements. Depending on your region, they'll meet with you either in person or virtually, but the goal is the same. They help their clinics work smarter and get the most out of Accuro. Working with your practice consultant is really about finding efficiencies because there's no single right way to use Accuro. Every clinic is different, and that's okay. What our PCs do is observe how our clients are currently using Accuro and identify opportunities to help improve their unique workflows. For example, earlier I mentioned that Control F10 for the quick patient view. Those are the kind of tips that your practice consultant can help show you. Also, let's say you're reviewing a fax and want to jump straight to the patient's chart instead of navigating back to the EMR, just hit F3 on your keyboard. Even learning of just a few of those shortcuts can really help speed things up. Another example, we'll often ask why something is being done a certain way. Sometimes it's for reporting, but other times it turns out just to be habit and it's no longer helping. One practice consultant told me that she had a clinic with over 300 different appointment types. After a quick review together, they streamlined that list down to only 12, which made scheduling a lot faster and cleaner for everyone in the clinic. They also look at how you're using the quick action keys. Maybe there's a tile on your dashboard that you rarely use, like the address book. Your practice consultant may suggest you replace it with a shortcut to something more relevant to your daily workflow. It's all about making Accuro work for you. So if you're not already connected with your practice consultant, please reach out. Even if it's just one session a year, it can make a big difference. So we know that the term add-on can sound intimidating, but augmenting your EMR doesn't have to be. These tools are designed to reduce burnout and free up your time. If you're working late, buried in admin from seeing patients, or your MOA is drowning in inbox tasks, there are integrated solutions that work seamlessly with Accuro. And you're not on your own when you're exploring these. Again, an ode to your practice consultant. They can help you evaluate which of these tools make the most sense for your clinic. Think of them as your own personal second set of eyes. And if they don't know the answer right away, they know exactly who internally to ask. Our marketplace is growing fast. Just this year, we've integrated with 10 new add-on tools. Accuro has always been strong for customization, but now with our marketplace, you can truly design a clinic platform unique to your team and how you work. Finally, let's talk about what's next. These are tools coming soon that we are most excited to share with you. First, patient messaging shared inboxes. We are revamping patient messaging with shared inboxes. This means that providers and clinic staff can collaborate on messages instead of everything falling to one person. It makes coverage easy, whether it's for vacation, locums, or just day-to-day workload balancing. And with mobile access, your team can stay connected and patients get a smoother experience. Now, here's the next big one. Accuro is getting its deepest AI integration yet. We've partnered with Heidi Health to bring you a fully embedded AI scribe. Today, AI scribes connect to Accuro through limited integrations. You log into the native scribe platform, generate your notes, and then push them back over to Accuro. It works, but it's not seamless. With Heidi, that changes. Soon, the scribe will be built directly inside of Accuro. As soon as subscribers open an encounter note, the Heidi widget will appear on the right-hand side. You'll be able to scribe directly into Accuro, no extra logins, and no switching platforms. Another benefit of this partnership is that Accuro has more say and control over the user experience. We're listening to providers and going beyond just another scribe to make it truly work for you. For example, you'll be able to choose which chart data is included in the note and easily send a summary to the patient. Early pilot customers tell us they love how intuitive it is, how simple it feels to use, and how it keeps them in Accuro. These enhancements, from better team messaging to our deepest AI integration yet, are designed to give you more time with patients, less admin, and more flexibility in your Accuro experience. That's all I had to share with you today, so thank you so much for your time. Burnout is real, Accuro is watching, and we hear you. We're listening, and we're really working to help. If you'd like to chat more about these options or you have any questions, please reach out via the contact methods on screen. Thanks again, and we'll see you next time. Bye for now.